there are many ways that we think about or conceptualize bipolar disorder. I want to talk first about the thought of bipolar as having a heavy biological component. Certainly, there is some biological component, but many people have the misunderstanding that we've actually found a bipolar gene. That is actually not accurate. Although that we're fairly sure that there is a heavy biological loading, when we've done monozygotic twin studies, they don't yield exact results. So you would expect in monozygotic twins that you would have 100% concordance in the manifestation of bipolar, but in fact that's not what happens. So mostly we think it's a multiple gene phenomenon, or certainly it is the effect of gene plus environment, which is not all that different than what we see in many mental disorders. A second conceptualization that's very important in bipolar disorder is what we have seen in terms of these patients' circadian rhythm sensitivities. Now, there's a little problem in our understanding of this because it's hard to know if this is chicken or egg. In other words, do they become very sensitive to interruptions in circadian rhythms because they have bipolar, or do they have bipolar because they have those sensitivities? But we definitely know they're there. And what we mean here is patients who present with bipolar have a history and/or at present have a lot of trouble adapting to changes in their regular daily rhythms. And we will look in a few moments at a therapy that is referred to as rhythm therapy, and rhythm therapy has certainly become part of what we do in the cognitive behavioral therapy. There are also, in our conceptualizations of bipolar disorder, various family factors that have been identified as being present on the environmental side. So for example, we tend to see a high instance of bad communication, poor problem solving, the presence of substance abuse or abuse in general in the family history of bipolar disorder. And then we also know that there are a number of psychosocial stressors that have been shown to dysregulate people. And this doesn't happen in all people, but it certainly happens in bipolar patients, and it becomes a bit of a presumptive diagnostic issue. So for example, we know that substance abuse can precipitate a bipolar episode. We know that the use of appetite stimulants or reducers can start a cycle. We know that when patients are sick with viral or bacterial infections, we can see an increase in the probability of cycling. When we have an impending pregnancy or during pregnancy, and also based on environmental factors as basic as increased stressors like deadlines, long and unpredictable work hours, large events. I would add to that changes in time zone, etc. So in our understanding or conceptualization of bipolar, we look at biological factors, we look at factors related to the individual's constitution like circadian rhythm sensitivities, we look at family factors, and we look at general environmental factors in daily life.